Welcome to my channel once again. Today we are going to look at some ethical principles used in nursing under course called professional adjustment. The main objective of this presentation is geared towards the key ethical principles and their examples in nursing practice. What are nursing ethics? Nursing ethics are moral principles guiding nurses to make safe and professional decisions in patient care. So these are guidelines that actually lead us to make right decisions when caring for our patients. What are the importance of ethics? So the key importance of nursing ethics is to protect the patient's dignity, to promote trust, to guide clinical decisions, prevent misconduct, and ensure quality care. Let's look at a brief example of an ethical practice. So a patient with HIV requests privacy. The nurse must keep the information confidential. Confidentiality is applied here where the patient details are kept only in the facility for healthcare system or healthcare team usage, not externally to other individuals outside practice. So let's look at the ethical principles in nursing we are going to look out for throughout this presentation. We have autonomy, beneficence, non-malfeasance, justice, fidelity, veracity, and confidentiality.
Our first ethical principle in nursing will be autonomy, and autonomy is respecting the patient's right to maintain or make decisions about their own health and treatment. Example: a patient refuses a blood transfusion due to religious belief. The nurse is expected to respect the patient's decision because of autonomy.
Our second principle is beneficence, which means doing the patient good. Beneficence refers to acting in the best interest of the patient and promoting their well-being. Example: a nurse repositioning a patient who is bedridden to prevent pressure sores and also report early signs and even caring for pressure areas is a significant example of beneficence.
Our third principle being non-malfeasance. So this means do the patient no harm. So avoiding harm to the patient during care and treatment. Example being checking all the five rights before administering medication in order to avoid giving medications or drugs to the wrong patient and even at the wrong time and even at the wrong dose or dosage. We have our next principle being justice. So this means treating all patients fairly, equally without discrimination. Health service should be provided regardless of a patient's religion, ethnicity, social status, gender, and financial status. For example, emergency patients are treated based on severity, not social status. Our next principle is fidelity. This means keeping promise and commitments made to patients. For example, a nurse tells a patient, I'll return in 30 minutes to change your dressing. The nurse should ensure that the dressings are changed as promised.
We have veracity. Veracity means telling the patient the truth about their conditions and treatment. Example: explaining honestly the side effects of medication prior to administration. Telling the patient the side effects will actually give the patient the willpower to report this effect in order for countermeasures to be done. So telling the patient the side effect of the drug as well as its benefits elicits or explains veracity. You have confidentiality. Confidentiality simply means protecting patients' private information. So example, a nurse should not discuss a patient's medical condition with friends, family members without consent, or people outside the healthcare team. For instance, discussing a patient's HIV status with friends is a breach of confidentiality. Let's look at what Ethical dilemmas are ethical dilemma is a situation where two ethical principles conflict in patient care. Example, a patient is diagnosed with a serious illness and asks the nurse not to tell the family. However, the family is requesting information about the patient's condition. The nurse must carefully balance confidentiality and family involvement while following hospital policy. Consequences of unethical practice: 1. Patient harm. 2. Disciplinary actions. 3. Loss of license. And 4. Legal consequences. You may harm the patient if care is not taken, then you may face disciplinary actions, and then you may lose your license as a nurse, as well as legal consequences such as lawsuits. Okay, we call it a day. Kindly like, share, comment, and subscribe.